Tricyclic Antidepressants Overdose. Tricyclic antidepressants are a class of psychotropic medications primarily used in the treatment of major depressive disorders, although their indications extend to a variety of psychiatric and neurological conditions. Examples of tricyclic antidepressants include Amitriptyline, Nortriptyline, Imipramine, Desipramine, Clomipramine, Doxepin, Amoxapine. Tricyclic antidepressants inhibit serotonin and norepinephrine reuptake. Although tricyclic antidepressants are sometimes prescribed for depressive disorders, they have been largely replaced in clinical use in most parts of the world by newer antidepressants. Clinical use of tricyclic antidepressants includes major depressive disorder, peripheral neuropathy, chronic neuropathic pain, migraine prophylaxis, obsessive compulsive disorder, Clomipramine, nocturnal enuresis, Imipramine. Tricyclic antidepressants inhibit the reuptake of norepinephrine and serotonin and are used in the treatment of depression. They also inhibit fast sodium channel conduction, slowing down myocardial depolarization and potentially leading to cardiac arrhythmias in overdose. Refractory hypotension results from decreased cardiac contractility and direct peripheral vasodilation from peripheral alpha-1 adrenergic receptor antagonism. Most deaths from TCA overdose are due to cardiac arrhythmias and refractory hypotension. Tricyclic antidepressants cause antihistaminic effects by antagonizing histamine receptors. This can cause increased sedation and appetite but is not implicated in death from tricyclic antidepressants. Tricyclic antidepressants block the amine reuptake pumps within the synaptic cleft, which normally terminate amine transmission. This permits a longer interaction between the neurotransmitter and the receptor, which is thought to account for TCA antidepressant properties. However, synaptic norepinephrine accumulation is not the mechanism by which death occurs following TCA overdose. Treatment of TCA overdose involves sodium bicarbonate therapy. Sodium bicarbonate increases serum pH, promoting TCA dissociation from sodium channels, and increases extracellular sodium concentration. These effects help overcome the sodium channel blockade induced by tricyclic antidepressants. Serotonin syndrome must be considered in suspected antidepressant overdose. Patients with serotonin syndrome have hyperthermia, autonomic instability, hyperreflexia, myoclonus, and diaphoresis. Cardiac changes are not usually indicative of serotonin syndrome. Although symptoms of excess serotonin may be present after TCA overdose, most deaths are due to cardiac toxicity. Tricyclic antidepressants do not increase presynaptic release of dopamine. Amphetamines increase the release of dopamine and norepinephrine by vesicles in presynaptic neurons. Tricyclic antidepressant pharmacology. Inhibitory effects and consequences. 1. Central and peripheral muscarinic acetylcholine receptors inhibition. This leads to tachycardia, delirium, dilated pupils, flushing, decreased sweating, hyperthermia, ileus, and urinary retention. 2. Peripheral alpha-1 adrenergic receptors inhibition. This leads to peripheral vasodilation, orthostatic hypotension. 3. Cardiac fast sodium channels inhibition. This leads to conduction defects and arrhythmias. 4. Presynaptic norepinephrine and serotonin neurotransmitter reuptake inhibition. It causes antidepressant and anxiolytic effects, also leads to seizures and tremors. 5. Histamine receptors inhibition. This leads to sedation and increased appetite. Tricyclic antidepressant overdose can cause fatal cardiac arrhythmias and refractory hypotension due to inhibition of fast sodium channels in cardiac myocytes. Sodium bicarbonate is used to treat associated cardiac toxicity and works by increasing serum pH and extracellular sodium, alleviating fast sodium channel blockade.